Welcome to the Lakeshore Unitarian Universalist Fellowship. We're happy to see you, whether you're new, a member, a friend, or someone who's just curious to see what we're about. I don't see anybody like that, but you never know. We value the 7 principles of Unitarian Universalism, and today we will be particularly emphasizing a free and responsible church search for truth and meaning, and the goal of world community with peace, liberty, and justice for all. The theme of our November services is healing, particularly appropriate for a season of COVID-19 and the election. Now we hope we will light our chalice. If not, I'll hold one up. Light this flame as a symbol of the new life enlightening our way, as a symbol of the warmth in every human heart.
Love is the doctrine of this congregation. The quest for truth is our sacrament, and service is our prayer. To dwell together in peace, to seek knowledge in freedom, to share our strength in fellowship, thus do we covenant.
With regard to the opening words, it's just as well that you don't have an order of service because I decided to change them today. And I changed them because I got a wonderful message from Kathy's sister Jean yesterday that had a great story from John Lewis. Aww. About 15 of us children were outside my Aunt Sineva's house playing in her dirt yard. The sky began clouding over. The wind started picking up. Lightning flashed far off in the distance. And suddenly I wasn't thinking about playing anymore. I was terrified. Now, Aunt Sineva was the only adult around, and as the sky blackened and the wind grew stronger, she herded us all inside. Her house was not the biggest place around, and it seemed even smaller with so many children squeezed inside. Small and surprisingly quiet. All of the shouting and laughter that had been going on earlier outside had stopped. The wind was howling now, and the house was starting to shake. We were scared. Even Aunt Sineva was scared. And then it got worse. The house began to sway. The wood plank flooring beneath us began to bend. And then a corner of the room started lifting up. I couldn't believe what I was seeing. None of us could. The storm was actually pulling the house toward the sky with us inside it. That was when Aunt Sineva told us to clasp hands. Line up and hold hands, she said, and we did as we were told. Then she had us walk to the corner of the room that had started lifting up. From the kitchen to the front of the house we walked, the wind screaming outside, sheets of rain bleeding on the tin roof. Then we walked back in the other direction as the other end of the house began to lift. And so it went, back and forth, 15 children walking with the wind, holding that trembling house down with the weight of our small bodies. More than half a century has passed since that day, and it struck me more than once over those many years that our society is not unlike the children in that house, rocked again and again by the winds of one storm or another, the walls around us seeming at times as if they might fly apart. It seemed that way in the 60s, at the height of the civil rights movement, when America itself felt that it might burst at the seams. So much tension, so many storms. But the people of conscience never left the house. They never ran away. They stayed. They came together and did the best they could, clasping hands and moving toward the corner of the house that was the weakest. And then another corner would lift and we would go there. And eventually, inevitably, the storm would settle and the house would still stand. And we knew another storm would come and we would have to do it all over again. And we did. And we still do. All of us, you and I, children holding hands, walking with the wind. And we are hoping that now we're going to have the opening hymn, Our World is One World. Reverend Robert Walsh. And here's what he said. When the great plates slip and the earth shivers, and the flaw is seen to lie in what you trusted most, look not to more solidity, to weighty slabs. Trust more the tensile strands of love that bend and stretch. I am so happy to introduce to you our speaker, who won't be a new person for you because Catherine has spoken to us several times before. We had said we wanted to have Catherine come back, and she and I were talking about what she could talk about. And I had remembered that she had been in Italy at the very time the coronavirus showed up. And you will also know that, as I said earlier on an announcement, in the spring of 2020, it implemented the longest and most stringent nationwide lockdown in Italy. By July, Italy was touted as a model for controlling the spread of the virus. But now, as COVID-19 cases are soaring in the US and rising again in a lot of Europe, Italy too is experiencing a resurgence of cases. Italians are being asked once again to stay home, wear masks, and endure closures of businesses and schools. At the level of national and regional government and at the level of local communities, families, and individuals, the response in Italy has been different from that of the US. Catherine says she will explore and attempt to explain the differences. She's a retired sociology and anthropology professor from the University of Green Bay, Manitowoc campus. Let's hear it for Catherine.
Hi, can you hear me? Is this still working?
We can change to speaker view and then we can see you even better.
Oh dear, all right. Well, let me start here. When Linda and I talked about this theme for a talk, it was, in early spring, not long after Jeff and I had returned from Italy. Since then, it's been hard to focus calmly on what's going on in Italy and in the United States. All of us are cycling through powerful feelings of fear, confusion, a kind of excited mobilization, uncertainty, determination, boredom, anger, and more fear of the illness, of losing our loved ones, fear for our livelihoods, losing jobs, closing businesses, bankruptcy, eviction, hunger, fear for our children's education, their physical and mental health, their future. Yikes. It's a lot to think about. I struggle to understand because the COVID situation in Italy, as in the US, has been so volatile. Worse, it's hard to figure out how to say something uplifting when the outlook for both our countries is so grave. A few factors do seem relevant, though. Italy and the United States differ strikingly with regard to size, economic base, and governmental structure. And Italians and Americans differ in how they experienced the pandemic and in how they understand themselves as members of society. So first, some impressions. We were in Italy from February 17th until March 10th. We had been planning this trip for ages to spend a month in Rome. So in spite of an emerging public health crisis, we went with gloves and hand sanitizer and the okay of a friend who's a public health physician. Italy had suspended flights from China on January 31st, but the US State Department had issued no restrictions on travel to Italy. Looking back, it is astonishing how quickly events unfolded. At the beginning of our stay, everything seemed as usual. True, at the airport in Rome, public health workers in protective clothing scanned us, checking for fevers. But a few minutes later, we had our baggage. We were meeting our cousins in the arrivals area. We rented an apartment near the Villa Borghese, near the homes of our cousins. And for 2 weeks, it was great, seeing the beauty of Rome as spring approached, getting a better idea of how the Italians live when they aren't swamped by tourists. And then gradually it got stranger. We watched the epidemic unfold in the north on the nightly news. We got explanations from our cousins whose Italian is much better. We wore our gloves and washed our hands a lot and noticed fewer people on the tram and in the shops. We canceled a trip to Florence, where we had hoped to meet with friends who live in Bergamo. Our cousins in Rome got increasingly edgy. They started asking if we planned to cut our stay short. And everyone apologetically declined the customary hugs and kisses when we met. By March 5th, Italy had recorded 3,089 COVID-19 cases. Schools, museums, churches, theaters had been closed throughout the country. Venice had even canceled the last few days of Carnival. And 148 Italians had died of COVID-19. Anxiety was rising among the people we knew. But on March 6th, we drove to the mountain town where my grandparents were born. There, our friends stood like this. They sort of stood back with their hands up and were sheepish about avoiding hugs and kisses. They joked that the local wine, Montepulciano d'Abruzzo, provided protection from the virus. A cousin canceled a dinner with us. Her sister from Milan had visited a week early, and she was worried that she might have been exposed to the virus. We returned to Rome Saturday evening, and there was practically no traffic. The autostrada and the ring road were so empty, it was eerie. And the picture you see behind me, actually, is of a major street intersection near our apartment a day or so before we left. And in normal times, there would be a continuous flow of traffic passing in all directions. On March 10th, the Italian government announced a lockdown of the entire country. We flew out of Rome that morning because Delta had already canceled our original flight scheduled for a week later. The plane was full of people leaving unfinished business and vacations and study abroad programs. When we arrived in Atlanta, passport control and customs all seemed pretty normal. That is, a bit chaotic with tired people standing in long lines. The only thing that seemed different is that we were given a card from the CDC listing the symptoms of COVID and suggesting that we quarantine at home for the next 14 days, which we did. And the day our 2 weeks were up, Governor Evers announced the safer at home order. You know what that was like. In Italy, the national lockdown was long and stringent, with restrictions being lifted only during the month of May. In addition to closing whole comunes or counties, towns in the north, no travel was allowed between regions. So you couldn't go from Lazio to Tuscany. Schools, universities, museums, churches, theaters, gyms, sporting events were all closed or canceled or postponed. Parks, restaurants, nightclubs, and bars were closed too. Nursing homes and hospitals allowed no visitors. On March 22nd, about 10 days into this national lockdown, factories were closed and all non-essential production was halted. Essential businesses, grocery stores, pharmacies, banks, and public transportation continued to operate. But for example, the number of customers inside grocery stores was limited based on the size of the store, and waiting customers were required to stand outside 2 meters apart. People were really pretty much confined to their homes, and police regularly asked for explanations from those who were outside, and they would collect a written note, from the person explaining their reason for being outside of their homes. Now, these arduous restrictions are even worse, I think, when you consider how many Italians live in apartments rather than single-family homes. Most socializing normally takes place away from home in restaurants, bars, sports clubs, parks, nightclubs, all very claustrophobic for families living in small apartments. Meanwhile, in the United States, there was no unified national response, but rather varying responses by state and local governments. I'm sure you've been following those developments. The president did declare a national state of emergency on March 13th, but no nationwide policy or directives followed. State and local governments competed for inadequate supply of surgical masks, ventilators, and other kinds of protective gear for healthcare workers. Closures of schools, businesses, and churches, social distancing practices, curfews, wearing masks, all became politicized, with the refusal to wear masks coming to symbolize political ideology. Perhaps the intrusion of politics into public health policy was unavoidable given the contentious election season in progress. But this development highlighted the fact that the pandemic has come down hardest on people already disadvantaged by class or race or gender. Not because the disease necessarily acts differently on people in these groups, but because people are differentially exposed to or shielded from infection because of their positions in our social structure. Similarly, access to medical care is also determined by social position. Social class differences, anti-immigrant sentiment, racism, religious antagonisms, a rising nationalistic movement, a distrust between North and South. These are characteristics of Italian society too, although stemming from different historical forces than what's been happening in the United States. So why did the Italians, notorious for flouting rules and regulations and riven by political conflict, observe the restrictions that effectively slowed the spread of the virus? And why did the United States respond so poorly that for months we have led the world in COVID-19 cases and deaths? This in spite of the fact of our wealth and medical and scientific expertise. I can't answer that 10 minutes, maybe not in 10 years, but here are some possibilities. One is that Italy got slammed by the virus, and people are quite reasonably scared of becoming infected. In early spring, as case counts and deaths skyrocketed in the north of Italy, epidemiologists were scrambling to understand how COVID-19 was transmitted and how it could be treated. Italians simply couldn't avoid the nightly news images of people struggling to breathe in their hospital beds and coffins piling up in morgues and churches. Fear can be a great motivator. Another factor is the degree of individualism in society. Journalist Beppe Severnino has written about one aspect of Italian individualism. He tells us that it's not that Italians disregard rules and regulations, stop signs, for example, but that they regard them as conditional. They think that if the rule rightfully applies to them for the situation they are in, they follow the rule, stopping at a stop sign when there's cross traffic. When the rule doesn't seem to apply, they are more likely to disregard it. Most Italians recognized that the rules imposed to flatten the curve were relevant to them, and they obeyed them. Now, both Italy and the United States are individualist countries. On a scale developed by a cross-cultural psychologist, the United States tops the list with an individualism score of 91. Italy's score, 76. Neither country is collectivist, say, like China, with a score of 20. But loyalty to family and community is more widely diffused among Italians compared with Americans, as is the notion that there is a web of relationships among the people in different parts of society. In the United States, individualism plays a key role in people's understanding of their place in society. Training for autonomy and self-reliance starts early, and competition is prized more than cooperation. An intense focus on individual rights over responsibility to community has characterized the increasing polarization of American society along cultural, political, and religious lines. Against the backdrop of a huge and diverse population, such relentless individualism undermines policies designed to promote action that would reduce the transmission of the virus. I think we should also consider scale. Italy is small. It's about the geographic size and shape of California, with a population of about 60 million, which is roughly equal to the populations of California and New York State combined. The US population is about 330 million, more than 5 times that of Italy. It's also the case that Italy's government is more centralized. Its 20 regions, unlike US states, are administrative units with limited autonomy. US states have authority over many aspects of government, essentially over anything not specifically reserved to the federal government in our Constitution. Both of these attributes, smaller scale and more centralized government, should contribute to the ability of a national government to address a national crisis, and I think Italy had that going in its favor. For another piece of the puzzle, I'll turn to essays by Francesca Melandri, an Italian author and journalist. In a piece she wrote at the end of September, which already seems years ago in pandemic terms, she discusses the relative success of Italy and the relative failure of Sweden in containing the coronavirus. The two countries had pursued radically different approaches. Italy chose a long, stringent lockdown and accepted horrendous economic losses. Sweden implemented no lockdown and relied instead on voluntary social distancing, working from home where possible, reducing reliance on public transportation, a ban on gatherings of over 50 people, and some restrictions on services in bars and restaurants and visits to care homes. By mid-July, Sweden had one of the highest death rates relative to population in Europe. Italy had the lowest. Now, Melandri is very aware that the course of the pandemic is very much in flux, and we should be too. Only time will tell which of the strategies that nations are pursuing will ultimately be the most successful. This is because the scientific evidence isn't all in yet. The epidemiological base is still evolving, and public health policies should be based on the science. So things are going to change as we go along. But according to Melandri, what Italy's government has done right, paradoxically, is exactly what the Swedish government has done right, although with opposite strategies. Namely, they have taken full responsibility for their public health policies in facing COVID-19. She continues, both the Italian and the Swedish government followed closely the advice of experts. Both, on the basis of this advice, then chose the strategy they deemed more suitable to the national sentiment, culture, political and social history. Both governments communicated this strategy to their citizens and told them how they were expected to act. So when Italians were told to stay at home, it wasn't advice, it was the law. If you flouted the law, you were fined and risked trial. Melandri believes that Italians mostly followed the rules because the government made them clear and took responsibility for having given them. From this point of view, Sweden and Italy shine, not because of the outcomes of their policies, but because they rely on the advice of experts to present their policy decisions to the public in an accountable and a consistent way. If we put the United States into this frame, it comes up wanting. We have been left in a haze of uncertainty by unaccountable leadership when what is needed is transparency, clarity, and enforcement. It's safe to say that we don't know how the pandemic will end. We are waiting to hear about vaccines and treatments and to hear how these will be distributed. We are waiting to hear if and how governments, including our own, will try to lessen the economic crises that the panic has created for their people. We may have to wait even longer to recognize this and to ameliorate the social and educational consequences of these long periods of social isolation. But for these projects to move forward with the least human suffering possible, accountability and transparency, which are democracy's very fabric, are absolutely essential. And one can hope that with the new administration, the United States will begin to move in these directions. If anybody has any questions they think I could answer, I'd be happy to try.
Catherine.
Yeah.
My husband and I were fortunate to be in Italy in 2011, and we were so amazed at like from 9 p.m. until midnight, the activity in all of the piazzas, the plazas, the big huge areas, 3, 4 generations all gathering, and the family tapestry of interaction and engagement. It was astounding to us and wonderful. And when you talk about individuality versus social, it seems that in Italy, there are, it does have a rugged individualism too, but not at the expense of the whole. And we were just so taken in, and it just felt wonderful to sit on the on stairs and just watch children playing. I literally sometimes until midnight, and great grandparents interacting, and it was just wonderful.
Hear, hear. I think what you observed is pretty standard operating procedure. We have cousins who live in Rome, and through them have met a lot of people in Italy. We lived there for a year, many years ago. But I was astounded and continue to be really impressed with the intergenerational interaction. I have yet to meet a teenager or young adult in Italy who's embarrassed to be out in public with their parents. They are much more likely to want to, well, of course we'll go out to dinner with you guys. And of course we'll come and say hello to your company, because they're kind of interesting, aren't they?
Yeah. Oh, yeah.
So, and the intergenerational thing has played a significant role in how young Italians respond to the pandemic. Some recent studies suggest that the top concern that young people have about the pandemic is whether or not they will give it to their older relatives. And I don't know if that's the top concern of young people in the United States. I'd like to think it is, but.
Very caring.
Hello, I've got a question. About 10 days ago, I read on the internet that the city of Melbourne, Australia, charged anyone in public without a mask $1,000, and allegedly it was very effective. You see that type of a technique being workable in the US?
Boy, I don't know. I mean, in Italy, the fine for being outdoors without a mask is about €400. And depending on the circumstances, it can be higher. I think law enforcement in the United States has a much more decentralized pattern. So it's really not clear to me who would enforce, such a statute. In fact, I was shocked to read that some counties in Wisconsin publicly announced that they would refuse to enforce Evers' attempts at putting a mask, a mandatory mask rule into place. Now, I'm assuming that county sheriffs, they must have the right somehow, or they must have the authority to decide what laws they're going to enforce. But I was shocked by that. So I do think it would be useful in the United States. I mean, lots of people speed on our highways, But if you get a $500 ticket for going 90 in a 60 zone, that slows you down for a while. So you wouldn't have to ticket everybody, but if you ticketed a few people, it might very well encourage mask use. It's not clear to me that every state in the union would effectively enforce such a rule. I don't know.
Thank you.
You're welcome. It wasn't much of an answer, but.
Although isn't New York somewhat successfully? I heard Governor Cuomo mention that there's a 98% rate of people wearing masks in New York. So I thought that was really interesting.
Yeah.
And I wonder if it's only because he displayed a level of leadership that we're not seeing in many of our states, and that he was on the news media daily talking to his citizens and
Yeah.
encouraging and being there for them. So I think it boils down to leadership is what I think it boils down to. I don't know whether we actually need mandates if we had excellent leadership nationally and across our states and even counties. I think it's bad here in Manitowoc because of a lack of leadership.
Jennifer?
Well, I just want to say one thing. I think leadership counts enormously, and that could be expressed both through, the kind of modeling behavior you've talked about and close communication. It could also be expressed through a mandate saying, we want to save lives, so you can't go 95 on the highways. We want to save lives, so you have to wear a motorcycle helmet. We want to save lives, so you have to wear a mask. But I also think that the reality of the epidemic is right in the face of New York residents. Whereas there have been, places in Wisconsin, I think Iron County was pointed out as a place where nobody wore masks or followed the social distancing rules until somebody got sick. And a bunch of people got sick. And lo and behold, since those events transpired, that county has a very low rate of transmission because they've adopted all these rules that would have made sense all along. So thank you. That's a good question.
I think
I'm sorry, somebody else was there and I lost them.
What was that?
Oh, Jeanette, did you have a question?
Well, I wanted to say it to the point of leadership. I mean, we've had really some excellent leadership in Wisconsin. Unfortunately, it's been impeded by so many other forces in the state that it's incredibly frustrating.
Yeah, I agree. Well, there again.
I just wanted one comment on that. When we look at Michigan, and that governor is in somewhat the same position, yet it seems that she's pushing much harder. So, and getting better compliance with mask mandates. I've been in the UP, and you don't go anywhere without a mask. I mean, absolutely not. So, and she's dealing with the same legislative issues that Evers is. So I don't know.
Well, I think one of the differences that we need to consider in that comparison is that, the state constitution in Michigan is different from the one in Wisconsin. The rules regulating the relationship between the government and the governor and the legislature are different. And there are variations across all 50 states. And that's part of the decentralization of authority that's part of a federal system, that it does make it messy. And so it's easy to talk about leadership styles and say, oh, I think a lot of people may perceive Evers as being kind of quiet. And a lot of people perceive Cuomo as being, this robust talking guy. And yet, constitutional and legal constraints have a lot to do with what governors can achieve.
Hi, this is Ginny again. I'd just like to point out, Sue and I have made multiple trips to Milwaukee, in the last few months. And we've noticed that in Milwaukee, even on the streets, people are wearing masks, even outside. And my granddaughter who lives there tells me that everywhere she goes, people are wearing masks. I don't know if that's because it's more sort of in their face because the virus itself is more active in Milwaukee, or if it's a leadership issue in Milwaukee. But for what it's worth, it does vary depending on where you go in Wisconsin.
That makes sense.
Of course, we have to also recognize that we had Gretchen Whitmer had some terrible rebellion against what she was doing, complete with gun-toting folks at having riots. So that was a little scary too. Somebody else said something.
Kidnapping attempts. Yeah.
I think that there's a cultural component to this as well. And Jim and I were in Minnesota. We were driving along the Mississippi River on the Minnesota side, and I was looking across the river at the Wisconsin side, and there were all these guys on their motorcycles, doing the hyper masculinity thing, and that there is a bigger piece of that. I think it has to do with the Harley thing, but there is an individualism in Wisconsin, or a sort of a value of individualism among white men, particularly, that you don't find in Milwaukee so much, but you do find in other parts. And it's kind of it's been more of a challenge to get those folks to understand that individualism is not freedom. It's a separate thing than freedom. And so that's been a real huge component and a barrier to the whole mask thing. And now that the virus is really here, it's really in our face, you do see people who are wearing masks. But I also think it goes hand in hand with good leadership. Good leadership can fill in the blanks, provide the education, give people direction. Even if some people reject it out of individualism, there's something there to hold on to. And the Cuomo example was amazing to me, not because of the leadership, but also because of the education. He brought people along, and he also helped people in the middle of the pandemic be the best versions of themselves they could possibly be, versus some ideological individualism, freedom argument. That's my 2 cents.
The other day, my husband, who remembers things that I don't, recalled the title of my dissertation, which wasn't about any of this stuff. It was about reproductive choices among American women. How many babies did they want to have? But the title was Freedom, Fairness, and Responsibility, related to the dilemma of fertility choice.
Yeah.
And yet, when we hear about freedom and liberty, we don't hear so much about fairness and responsibility anymore.
Yeah.
But 30 or 40 years ago, those virtues were clearly linked in Americans' minds and should be. So something's gone on that, has changed, which is probably, there's probably 10 bajillion books out there that we could read to find out how people are going to explain it. It's not as clear to me what one might do to bring those civic virtues back into balance.
Well, I think some of that is education. We no longer teach civics in school.
Right.
People do not know how government works or legislation works, but they also don't know about compromise and how central compromise is to the American project and to our way of life. And
Right.
when we are around the world and we're talking to different governments about the American project, that's what we're talking about. We're talking about compromise. That's the biggest difference between the American project and other democracies, is that we have such a value on compromise, and that's kind of fading.
At least we used to.
One thing if nobody has a question, I wanted to follow up just briefly on what's happening in Italy now. And I spent a lot of time trying to follow what's happening there. And over the last couple of weeks, there have been the kinds of protests that we're used to seeing here in the United States, that people don't want their businesses to close. They don't want to limit the number of people in their restaurants. They don't want to wear masks. They want to go out after 6 o'clock in the evening. And the government at the same time is in the process of issuing new restrictions on movement and behavior and business openings and all kinds of things. And one of the things that is going on is that kind of political advantage taking, so that nationalists and people with anti-immigrant agendas in Italy are taking advantage of the situation to insist that the government is out to destroy the country. But what's really, I think, the difficulty is a governmental failure, if you will, to continue to make good on some of its promises. So significant amounts of money have been set aside or promised for relief of individuals and small businesses. And yet the Italian bureaucracy still lives, and it is taking a while for this money to filter in. So some people have been waiting 6 months for relief and living on their savings, or, you know, living off their relatives. But going into new months of restrictions, people are freaking out. People really are afraid of what's going to happen and worried that the government isn't going to be able to provide them with the support it's promised to provide. And I don't know what's going to happen there.
Catherine, something you said was really interesting, and it makes me think about the connection between this individualism that we have decoupled from responsibility and fairness and the 2016 election of a narcissist. When does individuality shade into narcissism, a kind of national narcissism?
Well, that's been going on for a long time, though. I mean, I remember sometime in the 80s, that, you know, when we used to get Time magazine, the cover was about the me generation. And I found myself thinking, well, who are these people? Didn't we just get out of the 60s and 70s where it was an us generation? Like, what happened here? And then, you know, and then we got yuppies, and then we got, you know, the, you know, Bonfire of the Vanities. And I mean, this cultural shift has been going on for a long time. And it is coupled with economic changes that really have effectively disenfranchised, you know, half of Americans. And then you add to that Citizens United, that essentially makes our political voice equivalent to our wealth. It's easy to see how under those circumstances, you know, people feel more competitive and also feel that they have to be self-reliant, because who the hell's going to help them? So, you know, I think it's complicated, but I do think, you know, the talking heads who suggest that Trump isn't such an anomaly. I mean, he's a horror, but his, you know, what he's touching is real.
Yeah, there was something out there for him.
So, okay, is Linda still there? Did I not promise that I wouldn't get political?
I'm not remembering that at all.
Okay, thank you. I'm sorry.
Can I ask about something that Jen said about compromise and the importance of compromising, and then coupled with some of what you were sharing, Claire, about you know, when did the me generation, when did this individualism run rampant? It makes me think of I mean, freedom as an individual is making choices, and the choices that I make on my own are different than the choices that I make, when I'm with my husband, which that's probably him calling, than the choices that I make with my husband, and again, different than when I'm in a UU meeting. The choices that I make, what I choose to say, um, are about the whole and the good and the benefit of the whole. When you're in, as you expand out, the greater good becomes uh, an individual choice. I mean, you don't abandon your freedom to make choices, but the scope of your choices and the considerations change, and a compromise and balance is about that. I better get that, so excuse me.
I want to say that that is the ideal lead in to our closing hymn, which is We Would Be One.
We would be one, as now we join in singing our hymn of love, to pledge ourselves anew to that high cause of greater understanding of who we are and what in us is true. We would be one in living for each other, to show to all a new community. We would be one in building for tomorrow a nobler world than we have known today. We would be one in searching for that meaning which binds our hearts and points us on our way. As one we pledge ourselves to greater service, with love and justice strive to make us free.
We are the ones we have been waiting for. We are not perfect, but we are perfectly fitted for this day. May we be bold and courageous to chart that new future. May we have faith in a future that is not known.
And to rejoice, that is.